a notification here that I've started to record. So I'm muting everybody, and then we can kick this off. Right, practicalities done. So today we're going to be looking at the custom knee braces, how to choose and how to measure for them. And then we're going to be covering the measurement device as well before we have a live demonstration session. After that, we're going to be covering the measurement form as well and how to fill it out before we cover Q&As. So as I mentioned, just write questions throughout the entire session, and I'll cover that at the end. Right, so when to choose a custom knee brace. I hope you're all familiar with our knee braces. We have a big range of them. A lot of them are off-the-shelf braces where you have specific measurements linked to the different sizes. So at the bottom right, you can see this kind of off-the-shelf knee brace table where you take a thigh circumferential measurement and a calf, and then you choose the size out of that. So if the measurements, if these measurements doesn't really fit into an off-the-shelf size, that could be a reason to go for a custom one. So for example, it could be that you have an extra large thigh and a small calf. It could also be due to the alignment, varus valgus alignment. The off-the-shelf braces have a standard or normal kind of alignment in them. So if you go outside them, then you need to have a custom one. And it can also be due to an abnormal shape. And that can be various reasons why there is an abnormality, but it could be everything from a very muscular leg with big muscular thighs and calves, and a quite narrow and thin knee, but also the opposite, where you have an atrophy leg with small thigh and calf, and then a relative big knee in that. So the custom knee braces, we have two different ones. We have the 822, which is made of titanium. It's a very slim and light brace, and fits perfectly for activities of daily living, walking, hiking, running, but also sports like tennis, handball, etc. And then we have the Defiance, which is basically the Rolls Royce in the bracing world. It's made of carbon fiber, the strongest knee brace on the market. So very strong, robust, fits perfect to heavy patients, very active patients. If they're doing high impact sports like alpine skiing, ice hockey, motocross, enduro, American football is obviously a big one in US. And this kind of decision matrix just gives you an idea and helps you out how to decide on which brace you need to pick. So we have one on one side you see if it's just activities of daily living or high impact, and then on the other hand you need to decide, is it enough with an off-the-shelf kind of a standard with the different sizes, or do you need a custom? So you can also see how they kind of relate to our off-the-shelf braces. So the A22 is equivalent to a Full Force, Fortitude, Renegade, and then we have the Defiance, which is equivalent to the off-the-shelf Armor. So the Defiance gives you more options than the A22. The A22 is, you could basically say that there's a semi customizable brace where you can choose the size of the brace, and you can customate it to the size of the leg, but you can't really change the design of it, the look of it, and the different features. On the Defiance, you can basically choose everything, everything from the length of it to the design of it, the colors, the hinges. So you can have a standard polycentric hinge. You can have a drop lock hinge if you need to lock the knee in extension. You can choose the dampening force point hinge and an no-way unloading hinge. You can also choose the different strapping configurations, ACL, PCL, CI, which is the combined injury, which we recommend for obviously combined injuries. It could be an ACL together with a MCL injury, but also an ACL and maybe a partial PCL injury. So before starting the live demonstration on the measuring process, I just wanted to point out a few things on the measuring device. So starting off from the left upper corner, you can see the tape release buttons. So we have 4 different measuring tapes, and each and every measuring tape has a specific tap release button to tighten the measuring tape. If we go to the, if we just continue down on it, we can see the Condyle pads with arrows in the middle of them. These you will be seeing during the process are aligned with the upper edge of the patella. You can also see just right to the Condyle pads, we have the load plunger, which is which you use just to put enough pressure on the knee to get a nice and tight fit. And linked to that, you have the aligned triangle, where you can kind of get an idea of how much pressure you can put on them. And also the knee width window just below, and the lateral offset for the varus and valgus alignment. So with that said, we're gonna move on to the live demonstration, and I have a patient here with me today, and let's just here we go, and hopefully you see the the video on a large picture now. So first of all, you set the patient on kind of a normal stance with kind of shoulder width and equal weighting on both feet. Before applying the measuring device, it's always good to mark out the top of the patella where you're going to be aligning the middle point of the condyles on the device. So in this case, we have a patient here with a ACL injury on the right leg. So I'm palpating the superior edge of the patella. There we go. Placing a line there. And I need to unfold the device, and picking out from the bag, it's folded. So first thing, you need to release the handles. So you need to pull them before you actually can place them in the right position. Next thing is that you have a right side and a left side. The lateral offset part should always be laterally placed. So in this case, we have a right leg. We'll open the device up and align the measuring device and align the arrows on the center of the Condyle pads with the line that we have placed on the top of the top edge of the patella. Then we'll pull out the measuring tapes and hook them on. We have 4 different measuring tapes, depending on which length we want on the brace. I'm always applying all tapes, both for the stability of the brace, so it doesn't start to move around and change in alignment, but also the fact that at the end, it's easier to decide whether or not I need to have a short or a standard calf. Because in this way, you can just look at the measuring tape and see how that lies onto the calf. There we go. Here we have the release buttons. So just place the measuring tape box here, just tightly onto the leg and push the button. And that will kind of tighten the measuring tapes accordingly. Same thing down here. So you have one button for the short one, and the other one for the standard one is below. So same thing there, just make it snug and push the button. Here we have the right height of it aligned with the top of the patella. On the sagittal plane, we just want it slightly posterior to the mid-line of the leg. And then we have the third component, which is the transversal, the rotational component. And this component you can tell the patient to flex their knee just slightly to see if the measuring device moves about. If it starts to move about, then it's not aligned. If it doesn't, well, then you actually have it parallel to the knee joint. So thank you. And if you extend and flex it again, we can see that it's just a slight movement of the device, which is okay. So I'm happy with all the components, coronal, sagittal, and transversal plane. So as I start to measure, I want the patient to stand with a slight flexion of the knee, so about 5 degrees of flexion. And this is important to mention, so they don't stand and hyperextend, because it's quite easy to stand and in a comfortable position hyperextending. So with a slight flexion throughout the measuring process. So now we're ready to take the measurements. So I'll start off with the thigh. The standard measure is in inches, and the short one is in centimeters. In this case, I will be choosing a standard thigh to get the lever arm, and it's very unusual to go for a short thigh. It would be either if the patient is very short, or if they have some sort of scar tissue or something else that you want to avoid. So we have just a small white arrow on the device, and that says 19 4/8. The inches is always with eighths. So even if it's in the halfway and a half, that's 4/8. So we'll put 19 4/8. When we go to the calf, in this case, we have a patient who is 160 centimeters long. And in this case, this patient wants to be able to go back and ski, alpine skiing. So in this case, I will be choosing the short calf due to the length of the patient, and also looking at the measuring tape, you want to align that with the apex of the calf muscle. So that should always be the aim, to align it with the kind of mid bulk of the calf muscle. And of course, different factors needs to be taken into account. In this case, the alpine skiing with the skiing boots just makes it really obvious to go for the short one, so it doesn't conflict with the boot. Otherwise, it could be that we would go for the standard, as long as it doesn't go beyond the apex of the calf muscle, because then you're going to be starting to get some gapping between the frame and the leg. So in this case, I'm going for the short calf, which is in centimeters. So in this case, we have 33 centimeters. The knee width, here we have the load plunger. So many times we get the question, how much do I need to, how much pressure do I need to get to provide to get a good and nice fit? So the standard pressure with the standard leg, which I would say this is, then you can go with these alignment pyramids. So if you push the plunger, the low plunge, you just need to align the pyramids, and that will be the required pressure. When you do a lot of custom knee braces, you develop this kind of feeling and expertise that you can kind of sense how much pressure you want to put. But if you're uncertain, then this reference with the low plungers is really nice to have. But you also need to take more kind of factors into account. If we would have a patient with a lot of soft tissues, then we would need to provide even more pressure. But opposite, if we have a patient with an MCL injury who's really sore medially, then we need to take that into account as well, because then we might not be able to have such a intimate fit at the knee. The knee measurement. Here we go, 196. And finally, the lateral offset, which is the varus and valgus angle. Before taking this measurement, it's important to make sure the patient is standing straight and looking straight as well, because most of the time the patients are becoming curious and they lean over just to follow the measuring process, and that can definitely affect the angle of the knee. So before this measurement, especially, make sure they're standing upright and looking straight ahead. And here we have this string which is placed onto the numbers here. So 725, and that is just a reference number. So it's not the exact angle, but in the system we convert it into an angle. But it's also to make sure that the clinician doesn't start to make some roundings or affect the angle. So now we're finished with the measuring process. A lot of you have probably seen that in the measuring case, we do have these wheels as well. These are not used anymore. We started off with them to make sure that we caught the shape of the leg, but following up after thousands of measurements, we concluded that in, let's say, normal cases, it didn't make a difference. But in the extreme cases where you have an abnormal shape, then due to big scar tissues or similar, then we recommend taking a cast instead. So these here, just get rid of them, don't use them. It makes the measuring process easier, faster, and you don't really lose any features with it. So just same thing here, just unhook the measuring tapes, push the release buttons, and we're finished with the measuring process. So moving forward, now we're going to be filling in the measuring form. There we go. Let's see. Right. So the measuring form starts off with the account name, shipping information, and then we have the patient information, where you write the name, the age, the height, weight, and then right or left knee and measured by, and then if it's a new brace or a repair or a remeasurement. In this case, it's a new brace. Continuing, you can see the different steps, which we also have in a guide, in a brochure, that you follow these different steps. So starting off with the measurements, we chose a standard thigh, which had 19 4/8. We had a short calf in this case, which is then in centimeters, 33 centimeters. And here you can also see the range, which is possible within the Defiance. So just make sure you're within the range. The knee width, 196, which is just a reference number. And finally, the lateral offset, reference number here as well, 725. Then we'll continue to the step 2, where we need to decide if it should be a Defiance 3 with a swooping thigh, a medial swooping thigh, or a Defiance without the swooping thigh. I would say the reason to go for a Defiance without the swooping thigh is if the medial lateral stability is in focus, because then you get a longer lever arm on the medial side. In this case, it's an ICL injury. I'll go for the Defiance 3, which makes it more comfortable on the medial thigh. I'll choose a force point hinge because of the ACL injury. We want to dampening this knee extension, and I'm going to be choosing a ACL strapping. If this was a patient who was doing more extreme activities such as ice hockey, motocross, American football, then I would go for a Force Point Plus, which adds on a metal plate on the hinge, making it more robust, but also some metal caps and just a high strength steel as well. So this is kind of a more robust option. If it was an OA patient, then we would choose which compartment was affected. So for a medial OA, we would select the medial, and then we would fill in the degrees of correction in the frame. And you can see we can choose between 1 and 7 degrees of correction in the frame, and the standard is 3 degrees. So standard is then, I would say, below 3 degrees, you don't get that much of effect. So starting off with 3 is the normal, and then going beyond that, then you get more excessive correction. Worth noting is that then you have additional degrees in the OA hinge. Continuing to step 4, then we're going to choose the color of it, and you can choose between non-metallic colors and all these options, or metallic colors. In this digital form, that if you don't have it already, reach out to your local specialist to get it sent, or the customer service, and then they'll send it out to you, because it's quite neat to fill it in digital and then just email it. So we're going to go for a non-metallic, and then as you tick this box, these options are available. and we're just going to go for a black. If the patient would like multiple colors, that's possible. And then you can have one color on the thigh and a different one on the calf. And it's also possible to get a fade where it's faded to a different color. But as it says here, it's only it's not available for the matte colors. Just short on the features. I would highlight the metal caps if you want some reinforced strength in it. The reinforced carbon composite frame, which again, if you have a very heavy patient or doing extreme high impact sports, then this option adds another 4 layers of carbon fiber and makes it even stronger. And then the installed extension stop. If you don't choose anything, the default is 10 degrees of extension stop. And if you want more, then you make sure to put that in. So I'm going to be putting 20 degrees of extension stop, making sure that my patient does not go into this risk area of hyperextension. And this then combined with the dampening of the force point hinge just makes it really effective. And finally, the accessories here. You can also see, for example, the gel Condyle pad can be a good option, especially if they're sore on the medial condyle, for example, and they're not happy with the standard Condyle pad. Then this is a good option. Just to make sure, this here, we hear from customer service that a lot of customers are filling these area out, but this is just for internal use, so for DJO to put our reference numbers. If you would like some reference numbers or so, you always have the comments in the patient information where you can put some additional order information in. Okay, let's see. Right, so that was the measuring form, and now we're actually ready for the Q&A here for the last 10 minutes. So I'm just going to be checking the conversation. Perfect, thank you. Right, so one question here. How tight should the measuring tape be around the leg? So we have the release buttons, which they apply a standard kind of a standard tightness of the measuring tape, which for normal kind of legs is good. If you have a lot of soft tissue on the leg, then you might need to apply some more tightness in it. And most of the time, I would say it's rather making sure the measuring device is tight enough on the leg than actually making sure or trying to tighten the measuring tape more. So rely on the release buttons and make sure that the measuring device is tight enough on the leg. Let's see, we just received another question here. Sorry I missed the beginning, but I always have trouble unfolding the bow thing. What's the trick to get it to spring out? Good one. So I'm just gonna get the device out. So the trick here is to kind of pull out the bow before you can extend it. So let's see, so I make it clear here. Pull it out this way, that way, before you can extend it. If you don't do that, yeah, that's going to be a nightmare. Then you can try to extend it as much as you like, but it won't go anywhere. So again, make sure, pull it out, and then you can extend it. And you can also feel once it's in place, then you can lock it in that extended position. I hope that was a good enough explanation for you. Okay, great. Yeah, all right, good question here. So how can I order both liner versions for the same brace? So the suede and the chamois liner. So we have two different options on the liner. Standard is the suede liner, and the chamois liner we recommend more for water sports or activities that where you have a lot of if it's sweating or because it can take more let's say more moisture without breaking down. So if you would like to order both for the same brace, then you need to put that as a comment, because we at the features and accessories, you could tick in the box, but also make sure, just so customer care understands as well, that you want both. Make that a comment. So tick in the measuring form, tick in both suede and chamois, and then comments, make sure that that it's clear that you want both, and then you get a separate set of liners. Let's see. All right. For complex customer shapes, how much of the leg would you recommend we cast? We can do it with a 3D scan instead. Yeah, so good one. We only I would say it's enough if you go about 10 centimeters beyond beyond the measurement, the measuring tape, both superior and inferior. And the 3D scan is possible. So we have a program that can convert 3D scans. Let's see. Yeah, so the cast should be taken weight bearing. That's the ideal, definitely. And then make sure to send the cast negative to us. Yeah. Good questions. Perfect. I hope the answers were clear. If you have more questions popping up after the session, make sure to reach out to either a customer care or your local specialist. So this session is the first out of 8 that we have, and we're going to be having these sessions every second week. So look through the program. Make sure you you send in your interest for all the modules that you want to participate in, and we're going to be sending this recording out to you on a separate link after the webinar. Let's see, just one more question. How do we get access to the videos? Good one. So we're going to be sending out a separate link that you can follow and get access to it. Can you use the brace when the below leg rotate during pressure? That is that's a good one, and that's why I'm always very clear with the transversal plane as well to get that right. So what you need to decide is which position you should take the measuring on, because we do come across patients where as they flex their knee, it's rotating, the patella rotates as well. So you need to make sure that the measuring device is parallel to the line of flexion and progression, but also making sure that it should be measured in the position that the patient requires and will be in the most. So it's a tough one. It's really it is tough when the knee or when the lower leg rotates as they flex. So a good question, and again, really important to make sure that you check the transversal plane before you start measuring. Great. So that was time's up. Thanks a lot, guys. Thanks for joining us. I hope I'll see you again in 2 weeks, and I'll make sure the link will be sent out to you. So thanks again.